Today is World Suicide Prevention Day, a day devoted to understanding the risk factors and warning signs that lead to people taking their lives. Virtually every time you see a media story about suicide, it's followed by a number for Lifeline, Australia's leading help service for people at risk. With suicide and depression rates rising, Lifeline's more in demand than ever before. One day last month, it received a record number of calls, 1,893 in a single day. But 730's learned that thousands of calls to Lifeline go unanswered because the service is so badly under-resourced. Jane Hutchin reports.
As another day ends, it's time for most of us to shrug off the stress, clock off and head home. But at this call centre on Sydney's affluent North Shore, volunteers at Lifeline are just beginning the night's work.
Lifeline, how may we help you?
It's all right, just take your time and take a few deep breaths.
A volunteer is on the line tonight with a suicidal young woman.
Right. And I think tomorrow you should call the doctor and talk about what we've talked about this evening and look for some help to deal with those suicidal thoughts. And also,
she had an abortion during the day and is distraught and lonely. By the time the conversation ends an hour later, the caller is calm and agrees to speak with her doctor in the morning.
And please call us again if you find you're on your own and you're worried about your safety.
We try to help them relieve the distress that has brought them to that place where they're feeling that there is no hope and that there's no other option but to take their own life.
Anne-Marie Stannard is a former alcoholic. She lives in regional Queensland on a disability pension. Earlier this year, she reached a low point in her life, losing 3 friends, 2 of them by suicide, in the space of a few days.
It was just extremely difficult. I think it was one of the most difficult times of my life.
She called Lifeline.
It was late afternoon. Yeah, it was around tea time. I rang up and I used my mobile phone because I didn't have that phone at the time. And I rang them up, and at the time I'm thinking this is going to cost a lot of money because nobody was answering. And I just waited and waited and waited, and then I put the phone down.
She'd waited for 19 desperate minutes.
It's Lifeline, isn't it? That's what I was thinking. They didn't pick it up, and I just thought life couldn't get any worse than this.
In your experience, should someone in crisis have to wait 10 minutes, 15 minutes?
No. A person in crisis should be able to get a response immediately. I think that's the goal. That's absolutely where we must arrive at as a community.
Dawn O'Neill headed Lifeline for a decade until 2010. Every government organisation, every doctor, every hospital, every media report quotes the Lifeline number for anybody who's in need, usually after hours. Were you comfortable with that? Did that put pressure on the organisation?
Absolutely, it put pressure on the organisation, and that was part of the case and the argument when I first went to government and asked for money to start with. And I don't think everyone was fully aware at that time how strapped Lifeline was. And how much it ran on the smell of an oily rag back in those days, with enormous goodwill and enormous hard work by many, many Australians to fund and support it.
Lifeline was born when we discovered the power of the telephone.
Charismatic Reverend Alan Walker set up Lifeline in 1963. He'd taken a call from a man who later suicided. Determined to relieve such misery, Reverend Walker recruited a small army of volunteers to answer crisis calls from the public. 50 years on, Lifeline received more than 750,000 calls last year. Of those, almost 4 out of 10 calls were abandoned. In other words, callers hung up. Lifeline won't say how long they stayed on the line before hanging up. Another 3,500 calls didn't even make the queue because there weren't enough volunteers manning the phones.
Right.
Shouldn't you be able to answer all the calls?
We would love to be able to answer the calls. We're doing our best to do that, but I guess with the resources that we have, there's a limit to the number of calls we can answer, and we hope that every year we answer more than the year before. We would love to be able to answer all of our callers.
Since July, Lifeline has tried to address declining volunteer numbers by paying them on overnight shifts when most of the calls come in. They receive $150 for a 6-hour shift.
I think it's an absolute bonus that they're a paid shift, but I also think that because it is an overnight shift, that's a time when I wouldn't ordinarily have come out to do my volunteering.
Sounds like a terribly difficult time for you.
Other major helplines use paid professionals, but Lifeline simply can't afford it. The federal government contributes about half of its annual funding, amounting to $10 million a year. There's been no increase in the past 5 years.
Without the goodwill of the people who volunteer for our service, there's certainly no way in which we would be answering over 500,000 calls with the funding that we're able to obtain both from government and from corporates and from private donors.
So what you're saying is that you can only answer the amount of calls that your funding allows?
That's true.
Lifeline has been an organisation that really started as a social enterprise. So it had been self-funded for 40 years when I got there, or just on 40 years, and had a proud tradition of being independent and being self-funding. And that's a huge achievement for any organisation.
But times change.
But times change. I think the government needs to look seriously at what it's doing to support people in a suicidal crisis. It's going to need more funding, there's no question about it.
Good luck. Bye-bye.
Jane Hutchin reporting.